Hey you! If you're enjoying the Singing Teachers Talk podcast, then don't forget to hit the subscribe button. We are committed to bringing you engaging conversations and valuable insights from experts across the field of voice. By subscribing, it means we can continue to do that. You'll never miss an episode, and you'll be helping to spread the word to other singing teachers, vocal coaches, and overall voice nerds. So subscribe to this channel now and just watch your teaching grow.
Robert Price, when you go on holiday or to a spa or just in your everyday life, do you enjoy a massage yourself?
I do, yeah. I mean, I don't ever go to a spa. I don't think I've ever done that. But yeah, for many years, I mean, I actually, well, I got my first massage, I don't know, about 35 years ago, I think, at least. I was in Cork in Ireland, and I was doing a play in the Opera House, and I was just feeling not quite right. I was feeling a bit stressed, I think, probably. And the hotel I was in did offer a sort of massage service, and so I went for my first ever massage. I think probably people had kind of rubbed my shoulders a bit, in a party or whatever, but I'd never had a formal massage, and it was really remarkable. It was a sort of it was an aromatherapy massage, and it was a nice middle-aged lady wearing a smart uniform, and I don't even necessarily think it was kind of a brilliant massage. I mean, I can't remember. I'd have no way of judging, but I had this really fascinating experience to me of remembering during this formal experience of being touched. I had all sorts of memories of the ways I'd been touched by other people during my life, the nice ways I'd been touched. So I remembered various intimacies and family members and all sorts of things. And that wasn't what I was expecting. I was expecting, I think, a sort of a sports massage, I guess, as much as I had an idea of what that was. I certainly didn't anticipate that I'd have this quite curious memory palace experience. Um, and after that, I got fairly addicted to massage. So if I was ever on a gig somewhere, or if I was just feeling not quite right, I would go and get massages. So I've had loads of different ones, and I didn't have a theory as to what was the type of massage that I found most useful. I did find that the person mattered to me. So if the relationship was good, then the massage was good, and that was useful to me. And it's become my principal way of sort of getting therapy, really. I often say to people, I've never had therapy. I had one anger management session about 20 years ago, which was really useful. And that's my only therapeutic encounter, apart from the many people I've encountered through touch. So yes, absolutely.
Yeah. I like massage. I like a vocal massage. If I feel particularly like if I've got lactic acid or DOMS or something, I quite like somebody to prod me in those areas. But the thing that I have found a little bit, oh, I'm not too sure how to deal with it, is when I have had like a spa massage or a holiday massage, and it's
Mm.
like one of those full body ones, because I get so stressed and I think I get more tense because I'm one, is that going to tickle? I really don't want you to touch me there. Just go away. So
Yeah.
yes, maybe I need to find the right sort of person to do the full body massage, maybe.
Yeah, or maybe just don't do a full body massage, or get a nice, if you want somebody to work with your whole body, go and get a nice chair massage style massage, which is dressed, because those things are totally relevant. I mean, there's if you're lying there kind of gripping the couch thinking, can they see my bum, and I'm not into that, then that takes away the whole value. I mean, I think we'll talk about this maybe more later on, but I think probably the fundamental value of massage for me, let's just say bias is kind of on the table, is to move people from a sympathetic state to a parasympathetic state. Like I think its single biggest value is in calming down the nervous system and connecting to another person. And so comfort is very high on my list of priorities, both when I receive that kind of touch, and I hope it would be my intention to make people feel comfortable, very comfortable when I give touch.
Mm. And is that then one of the benefits for a vocal massage? Can we feel that parasympathetic nervous system take over when it's located at the voice?
Yeah, as I say, I would think on some level that's the principal kind of provable or experienceable thing. And it's specific, I think. So somebody who comes for a vocal massage will either just be, I mean, there's the notion of sort of maintenance. So some people believe that it's a useful part of being a vocal athlete. And that idea has been sort of sold to people, I think, and people like that idea. So that's completely cool. Or people come because they're having some kind of a crisis or some kind of a problem or experiencing some kind of a change they don't understand. And so the sort of cluster of sympathetic symptoms, the stress or anxiety they feel, is present in the whole system, but it's also located in that very particular place. So I think often people are holding on to that anxiety. And, it's like when you get a weird lump, or I've got a dodgy tooth at the moment. It's a little bit wobbly. I'm pretty sure it's a wisdom tooth thing, but obviously I'm kind of concerned it's other things. And so I probably think about it about once every minute. And eventually I'll think about it so much I'll actually go to the dentist and get it sorted out. But that's an ongoing thing, and that's going to produce all kinds of neurological kerfuffle around the location. And so, yeah, I think we're working with that both in a general and in a very specific way, or seeking to work with that.
And what would you say are the other benefits to having a vocal massage?
I think it's incredibly subjective. I mean, you've spoken to Walt. I think Stephen's been on the podcast, so we kind of occupy a slightly sort of agnostic space within the manual therapy world, and that's a sort of a choice people make, or it's just dispositional. I guess it's the way you think, the kind of thinker you are. So I've never signed up to any single theory of what happens during touch, and I don't think objectively anybody knows. You can't dissect a live human being as you do massage on them. You can do brain scans, and there are things you can do, but I don't think anyone knows precisely what happens. So you either decide to sign up to a particular theory of touch. I'm affecting myofascial trigger points. I'm creating a change in sarcomeres, and that changes taut bands, and that reduces referred pain patterns. That's a completely believable and coherent theory, but it's a theory. You might be working with energy meridians. You might believe in the more Eastern sort of inflected forms. You might be thinking about lymph. You mentioned toxins earlier. I don't actually personally think anyone has a clue what happens when you touch people, really. And, there's reasonable evidence where they've done things like asking leading chiropractors to assess people's spines, and they will give those very, very scientific sounding theories. And then you compare notes from America's top 5 chiropractors, and they're all completely different. Usually it helps people. Sometimes it helps people an awful lot, but and sometimes it doesn't, but quite what's happening within that, I think, is about the person. So I think, and there's an awful lot of encounters that I have for which there is no evidence. I mean, myself and Stephen talk about this all the time within the realm of muscle tension dysphonia, partly because of the history of manual therapy. There's a lot of good evidence. But people come to me for all sorts of reasons. They come to me because, to give some examples of my favorites, they're a sword swallower who's also a vocalist, and they've injured their esophagus, but with swords during their career, and they feel a sense of discomfort and unease in that region and suspect they may have done something serious, even though they've had all the tests and scans. Well, there's no scientific paper about that. There's none. There's nothing. Or I had a singer once, really interestingly, who was heading off on a big world tour, quite an established singer, and she had a daughter who was anxious about her going, a young daughter, and they'd slept together the night before she was leaving, and when she'd woken up, the daughter had been lying across her throat,
Oh,
sort of fallen asleep across her larynx, and this singer was understandably anxious that there'd been some kind of damage done. And I don't even, I mean, that's very complicated, isn't it? There's all, you immediately start to have all sorts of thoughts about what that could mean. Did that really happen? Did the daughter kind of attack her mother's larynx? Was there some sort of sleep hallucination going on? Was it, I mean, I don't know. I don't think anyone could know. And I don't know how you would decide how an encounter through manual therapy would be helpful for that person or not. But I think in both those cases, I was able to help those people considerably, or rather, they were able to help themselves by asking somebody to put their hands in the place where they feel that sensitivity. Lots of people who've experienced strangulation or blunt traumas to the throat, I wouldn't presume to know what happens when I work with somebody in the context of a manual therapy session.
Yeah. So when you actually first put your hand, your fingers, say on the neck or around the larynx, what exactly are you feeling for? And what do those things feel like for you beneath your fingers?
Well, I'm feeling for the anatomy that I'm confident I can palpate accurately. So I'm sort of trying to get to know the person's body. And I have a way of working which is that when I first encounter people, things are not always that clear. I mean, I've touched an awful lot of larynxes, so I do have an instinct, and I think also actually one is working through gross anatomy, what you can see from the outside. So I think you get very good at being able to see from the shape of people's structure where things are. Although you have to maintain a bit of humility about that. Maybe we can talk about that in a sec. So I'm seeking to connect with their anatomy and to see how clear it is, and also probably more importantly with those first touches to really work to make sure that the person has agency over that touch. So the style of manual therapy that I practice, which is very much informed by Stephen King's approach, which is related to people like Walt's approach, puts consent and contract, genuinely right at the heart of that encounter. So I will work quite hard with people to make it clear that if anything feels uncomfortable or unhelpful or unsafe in any way, that they'll let me know and I'll change my touch or work in another place. And people who are injured and anxious and have a gig coming up, I think when they enter the space, their basic assumption is that they will submit to anything because it is like going to the dentist. So when my wisdom tooth reaches crisis, of course, when I go to the dentist, I won't expect them to say, well, if this feels uncomfortable in any way, we can work on another tooth. I will grip onto the couch and let them do whatever they want to do. What I do and what we do is not dentistry. So I can't remove the person's pain or malfunction using my hands. That's just daft. So I'm looking to sort of sense, or through various kinds of communication, whether that touch is safe or helpful for them. And then I don't know what I'm trying to find, but I usually know when I'm there. So I start to get a sense of it. Does this region feel somehow held? Is there kerfuffle? Is it unclear structurally? Is it really wangly and wongly? Because so many of our clients are hypermobile. But I don't think you can know by touching a tissue whether it's tense or not. I think that's also a sort of an error. Because if I have a 78-year-old who's had surgery for a tongue cancer, their larynx will feel different to a ripped 21-year-old boy in a musical theatre show. The muscle will feel totally, totally different. And I don't know what that means. But if that boy is hypermobile and that other client is not, it's a very kind of complex, multi-dimensional continuum.
Yeah.
And also, I don't think it's useful to tell people they're tense, by the way, or this is the tightest larynx I've ever held. I think that's the most unhelpful thing that manual therapists do, and they do it. And people also want you to do that. So it's tricky, these conversations, because I don't want to sound totally incoherent or like it's a completely cloudy, nebulous thing, because the structure and the anatomy is their landmarks. I mean, that's a wonderful term. They're places where you go in order to find out where you might go next. Just like in a city, you find out where Oxford Circus is, and then you can work your way down to Soho. So it's sort of about working out where you are, really. And once you know that, you can perhaps figure out where to go.
And as you mentioned before, there's a contextual landscape that you have to explore to make this all make sense, I can imagine, with as you've described some of those potential scenarios you might find yourself in. And you said also just a minute ago about how you can kind of look at somebody and see where things might be and that sort of ideas. But you said that you had to be kind of careful on that. So can you just delve into that a little bit more?
Yeah, one of the things I've found really enriching for me as a voice teacher, actually, and as always with life, I wish I had this knowledge when I was teaching huge numbers of people, which I did for a long time, is just the limited value of models. And this is something I didn't make up myself, so these cleverer people than me have made these points. But I'm actually going to get a little model of the Eiffel Tower and put it in Broadwick Street where I teach, and say to people at the beginning of the courses that we run, look, this is a model of the Eiffel Tower. It very clearly isn't the Eiffel Tower. And there is some value in this model of the Eiffel Tower. There's something we can learn about the actual Eiffel Tower by looking at it. It's quite limited. I mean, the difference is vast. Now, here's a model of the larynx. And this model of the larynx is about as relevant to an actual human larynx as this model of the Eiffel Tower is to the actual Eiffel Tower. And that's true for any image or model you have. And partly that's because of the really quite bewildering range of possibilities in anatomy. We call them anatomical variations. And in the region of the voice, they're really considerable. And sometimes more than 50% of people will have a variation which is not the standard. So when we flick through our vocal anatomy textbook, or we look at models, with certain things, it's possible that most of our clients actually won't have that variation, that the standard variation is merely that, it's a standard variation. I don't usually identify accurately which variation my clients have. So I can't tell. I mean, to give an example, it's kind of a fascinating example, the digastric muscle, which is principally a jaw opener, also involved in stabilizing the larynx, maybe raising the larynx. It's got all kinds of functions, which runs from underneath the chin to the mastoid process. In every textbook you'll look at, it's this lovely, neat, little kind of parallelish double line thing. Well, when they examine cadavers, they find that most people don't have that standard digastric. They'll have any one of a bewildering range. Some people have 7 digastric muscles. They have things moving across and they cross like this. And you sort of think, well, that's really interesting. Because when I was looking at students when I was a voice teacher, and I would sort of go, oh, I think you've got a tight tongue root. I suspect that some of those people just had a really funky digastric muscle. And you think, well, how much damage did I do? Because as we know as teachers, that means that person will spend the rest of their life talking about how they've got a tight tongue root. And of course, that region is much more complicated than the tongue anyway. So I just try and remember whenever I touch somebody that I just don't know what I'm touching.
Yeah. And in that sense, then, how do you know when the massage has done its thing? How do you know when it's worked, if you like?
Yeah, it's a really good question. I mean, the general state of somebody, so the experience of moving from a sort of place of stress and anxiety about this thing to a place of some kind of clarity or calm, you can see that because people change in their bodies. They take a breath, their skin color changes, they release their shoulders, they look happier, their eyes soften, the jaw releases. I mean, the things that we associate with a slightly more relaxed state, that's normally quite clear. So the global markers are apparent. I quite often notice that the person's anatomy will start to become clearer to me. So if I first touch them and it just feels a bit like a sort of vague kind of gathering of things, as I work, usually things start to become clearer. And I mean, I think they have actually somehow changed or change has taken place. And then the nice thing about vocal massage is usually people will report a difference in sensation. So their swallow will feel different, their voice will come out easier, they'll use different terms. And usually you can hear a change. So it's not at all uncommon for there to be quite a noticeable change in the quality of the voice. And that's quite nice as compared to other forms of manual therapy. And I do lots of different manual therapies that often the change is quite clear.
When we're working in an area where there isn't really a defined answer, or you can't really know for sure, or you're just kind of following a hunch, where do you find the job satisfaction? Like when you go home and you kind of think, oh, I did a really good job today. In other realms, in other fields of industry, you might get, your appraisal, you've got the statistics in a particular office, or your manager here, you can see on the chart you've done so many commissions or something. And other people might find that, they've got structural evidence that they've done the right thing. As voice teachers and yourself as a manual therapist and a vocal massage therapist, where do you find yes, that was the right thing to do?
Yeah, that's a great question, isn't it? I mean, I think I also trained as a Qigong teacher many years ago, and during my training, the master said to me a brilliant thing. I was talking about all the different experiences I had, and how some weekends I'd go home and I wouldn't be able to sleep, or I'd wee all the time, or I'd get weird buzzy sensations in my head, or whatever it was. And he said, "Yeah, you've just got you've just got to remain indifferent to the sensations." And I've thought about that a lot in my subsequent life. There are so many experiences, and teaching is one of them, where if you choose to become fascinated by how many different thoughts you can have about your role as a teacher, from I'm just a charlatan to I'm a magician to everything in between, you waste a lot of time. I think it behooves us. I never use that word behoove. Anyway, I think that's a word,
What
isn't
a
it? I
great
think
word, a behoove.
I don't know, behoove. It behooves us to, of course, to be critical, and to think about our work, and to seek to increase our knowledge, and to develop new tactics and techniques. And it's lovely to speak to old students and get feedback, especially on that long form. I mean, I really like that. There are people I taught 30 years ago who are now in really good places in their professions, and it's helpful for me actually to talk to them about the value or otherwise of work that we did together. But in answer to your question, I think you just have to be indifferent to that, not lazy or uninterested or arrogant about what you do, but I don't think you can possibly predict the value of any particular encounter or any particular course. So I mean, I look to be, as far as possible, reasonably physiologically accurate in the things I think, and then in whatever I'm doing, just try and work out ways to help people make sense of that for themselves, because the other side of teaching, of course, is learning, and I think it's the learning which is the crucial thing. So yeah, I try not to worry about it, because if I did, some days I would definitely go home from Broadwick Street and think that I'm just wasting people's time and money. And other days I would walk home and I would think, wow, I'm saving people's voices and making a huge difference to people's lives. And I don't think either of those things is true. I think the truth lies, as it always does, somewhere in a kind of slightly less spectacular middle.
I'm just pressing the pause button on the podcast for a very brief moment to invite you to book your free BAST call. If you've been thinking about joining the BAST community through one of our courses, but you just don't know which option is the best for you, then why not book your free Zoom chat with our very own Kimberly George, who has all the answers. Head over to basttraining.com/book-a-call/ and click that big blue button. That's basttraining.com/book-a-call/. Now, where were we?
We can do self-massage on ourselves if we are in a warm-up, a cool-down, or if we feel like we just need some intervention. Is self-massage just as effective as visiting a therapist?
Well, it could be more effective than visiting a therapist, but only if you're really, really good at massage. So I think I love giving myself self-massage, and I think I can really help myself. But that's because I sort of have various types of knowledge. But I don't think that's based on education. Like, I think some people just are really good at touch, and some people have really clever hands and a way of being in that relationship with other people or with themselves. So yes, I think self-massage is brilliant, as long as we don't think it's some kind of a cure. And probably there's a sort of neurotic danger, I think, with self-massage. When I used to teach, I used to sometimes, there were certain types of students, and I'd see them once I'd showed them something or done something with them. I'd kind of see them in the wings or on the stairs or everywhere, fiddling with themselves. And I think this has just become another sort of neurotic space. And of course, one has to recognize that when you're dealing with touching yourself or somebody else, you're dealing with a pattern, I think. And patterns come from somewhere. And it's the where the pattern comes from, which is the real site of investigation. That's the crucial thing to work out, what's the motive, or what's the attitude, or what's the trauma perhaps. Like, what is it that's caused the thing? Because kerfuffle in a muscle is some kind of contraction. Like, it's something, it's a signal that's coming from somewhere. So I think there's a phrase I really like. Sometimes self-massage becomes a kind of enactment of justice. So it becomes almost a kind of curious space of self-punishment or something, and that's terrible. So in that case, people are better off leaving themselves alone. But if you can realize that there's something going on, that you can communicate with your brain, and perhaps even with the thing behind the thing by touch, and do it with sensitivity and care and safety, because there are a couple of structures that you need to be aware of, I think, when you go into the anterior neck. I trained as a sports massage therapist and a clinical massage therapist, and we never did this region. And that's historical, but there is a good reason for it. There are three structures that you need to be a little bit careful of. So, never use a massage gun on your larynx. And that sounds crazy, but I've had a student in a drama school once say to me that we were discussing to touch and maybe trying a few gentle things, and she came in a week later and said, "I've been massage gunning my throat, and it feels much better." So gentle and thoughtful and aware touch, yes, and realizing that you don't know the outcome, cool. Anything which is overly aggressive or neurotic or obsessive, don't go there, I would say.
Yeah. I'd love if you could take us through a couple of examples of things that we could do for ourselves. Could we start with the neck? Is that something that you could show us how to do safely?
Yeah, absolutely. And in terms of safety, just to say, I'm sure your listeners and watchers will understand this, but the hyoid bone is breakable. It's a breakable bone. Have you seen The Wire, the TV series The Wire?
No, I haven't.
No, it's kind of fun to watch for a voice teacher. So in the last series, Dominic West is trying to make people believe there's a serial killer in Baltimore. And so he decides that he needs a modus operandi. So basically, he's finding homeless people who have passed away. This is a bit grim, but anyway, he's finding dead people, and he's snapping their hyoid bones. So he's strangling them so that people think there's a serial killer, and that's what he does. And he's sort of, it's like he's a strong lad. And weirdly, I actually know Dominic through other people, and so I know that they did their research. So the amount of force he puts into that movement is right. They try to work out what you would need, and it's not an obscene amount of force. I mean, it's something that anybody, you could probably, if you wanted to, snap your hyoid bone right now using your own physical strength. So we don't ever put strong medial pressures into the hyoid bone or the region of the hyoid bone. That's really important. The other thing is, as you work in the neck, you may sometimes feel a pulse. That's your carotid artery, and the carotid arteries carry an awful lot of blood to your brain. So each one carries about 40% of the blood that runs up to your brain. So if you were doing something bilaterally, if you were working with two hands and you sat right on your carotids and felt a really strong pulse and held them, you would change the amount of blood going to your brain. And over a couple of minutes, you would start to feel woozy, and then you would pass out, and then your hands would come off, and you'd probably be fine. So you certainly don't need to panic when you touch a carotid artery. But the best practice is, if you feel a strong pulse, you make an adjustment slightly forward or backwards, the left or the right, until that pulse changes, you no longer feel it. Or you just feel the echo of it through other tissues. That's okay. So you might feel a very gentle sort of sense. And the other thing is that behind the ear, so between the angle of the ear and the jaw, deep to the mastoid process, there's a little thing called the styloid process. And styloid processes are also breakable, and come in great variation. Sometimes they're very long. There's a condition called Lyme syndrome, which I think is probably more common than people realize. So then people have a really long, delicate styloid process. So don't squeeze your hyoid bone. If you feel a pulse, make an adjustment, and don't go delving around in this region here. And that is a place where people feel pain and discomfort quite often when they've got voice problems. And it's not that you can't gently connect to that area, but if you sort of felt like, oh, it feels good if I dig my thumb, that's an unsafe region of the body to press hard on.
Okay, great. The warnings have been had.
The warnings
Don't
have been
break your
had.
hyoid bone.
Yeah.
Don't break your styloid processes. Be gentle. I mean, can we do ourselves? Will our bodies tell us if this is too much? Or, you just mentioned about, oh, that feels good if I go in really hard. So how do we kind of listen to reason and not with the pressure that we kind of feel we like?
Well, that's impossible, isn't it? I think that's it, because you're working with a set of feelings about what's right for you. And I think when I teach people self-massage, I'm sometimes curious about how inept they are at it. So how quickly or thoughtlessly they'll go to things, or they'll tug at things, or they'll move. I mean, I always think it's interesting. An anterior neck stretch, I'm sure every singing teacher in the world does that. I think it's really useful just to open up this region, and it's in the territory of self-massage. So especially if you connect with that suprasternal notch, jugular notch region. Do you do this? Is this a thing you teach,
Yeah,
Alexa?
definitely. We do kind of stretching and guiding the hands down to have a little enhanced stretch or connection to the sternum.
Good. And what are you? I'm curious. So when you're doing that, what's your thoughts? So from
Oh God,
the point of view of,
here she
no, I'm
goes.
not
She's
trying to
on
put
the
you on the
spot.
spot.
So as in what my strategy is
Yeah, and
to
what your
guide.
target is. So what's your thought in
Yeah,
terms of what you're possibly affecting on a
muscular level.
musculoskeletal level?
So if for myself as a singer, if I kind of reference it as butterfly hands and
Yes.
pop them on the chest and guide the skin downwards, and I might do a raising of the chin to the ceiling as like a platysma muscle stretch, I believe. So down the front of my anatomy isn't the best. Down the front of the neck, is it a superficial muscle layer?
Yeah, absolutely.
Um,
Yeah, the platysma is this funny, weird, complicated muscle, and where your hands are there, yeah, that makes complete sense. I mean, again, we don't know where somebody's platysma starts or stops, but that
yeah,
makes complete sense and will feel good.
yeah.
I think the journey, maybe this is I did a lot of Feldenkrais work when I was younger. So for me, the first note is always don't just try and get to the end point.
Mm,
So it's as much about being inside the journey towards the place as just getting there, because who knows what you're going to affect. And that is indeed, that makes a lot of sense. Platysma wise, you're also maybe sitting on the sternum, maybe that'll do something in terms of breathing, who knows. But also you've got all of the muscles that are running up the front of the neck, especially the muscles beneath the hyoid bone, the infrahyoid, and then perhaps the suprahyoid stuff as well. And that connection can be enhanced by being a bit more targeted onto the jugular notch. So what you were doing looks lovely in terms of the platysma, perhaps, but if you make it more there, so you could actually put your hand slightly higher
okay.
or use your fingertips. I mean,
Mm,
butterfly hands is something your body likes, but it's up
mm,
to you. And really engage with that region. Now, it can be sensitive. It's a useful area to connect with if somebody has globus type symptoms, if they have a kind
okay.
of lump in the throaty feeling. This is a good place to go. And a good test to see if you're in a useful place or it's not entirely pleasant is, once you've made this draggy connection with that region, is to swallow. So try a little swallow. Did your swallow feel sort of compromised?
There was a little stretch in there.
little stretches, like it's
Yeah.
kind of being held onto.
Hmm. Yeah.
And if you then put your hands maybe back on that more platysmary area and swallow, does that feel less engaged?
Yeah.
That's quite interesting because it suggests that when you put your hands here, you were connecting a little bit more specifically with some of the muscles that raise and lower the larynx,
Yeah.
which I think might be useful for us. And perhaps it's the stenohyoid, which is probably tucked behind the SCM in about there. I find this really useful. So I'll just gather and then maybe with your teeth together initially look up. So, and let's not call it a stretch, let's call it an opening or an exploration or something more flaky than that. But with your teeth together, just slowly look up and be as involved in every part of the journey as the destination. And just feel whatever you feel, enjoy that. Nice. And then come back. And maybe if you were my student, which you're clearly not, I might say, Alexa, you look to me like the kind of person that likes to go to the end of things, like likes to go kind
Hmm.
of all the way.
Yeah.
But maybe it might be quite interesting to think what's 70 or 80% of that movement and stay there because that'll be safe. I mean, if 100%, there's no 101, the dial doesn't go up to 11. So if you go to 101, you're going to injure yourself. That's where injury occurs. I think let's stay like well away from that.
Okay.
So rather than thinking about going as far as you kind of can, just go like, yeah, let's see what 80% or 75% looks like.
Okay.
Yeah, do that one more time. Lovely. Good. And then, how's that feeling? Does it feel safe?
Yeah. Yeah. It feels safe. By the way, this is what my tan is. Usually when I go on holiday,
Yeah.
I go lobster red, and then when I do self massage, it's the same. So it's like you don't have to
Um,
spend loads of money for that, Alexa. Just stay in the UK and do some self massage. And listeners, by the way, if you are listening to this on audio, we'll try and describe as much as we can, but it might be good or useful for you to head over to our YouTube page just so you can see these visuals and do it along with us as well.
yeah,
Yeah.
no, thank you for that reminder. Yeah, so Alexa's fingers are on her the area above the sternum, very much sort of connecting with that soft part of the throat, which can feel vulnerable. So remembering our
Mm.
thought that if this feels horrid, don't do it. Don't think, oh, I must do this. This it's not going to be the solution to anything. So it's just
Yeah.
curiosity.
Yeah, for
Um,
me, it doesn't feel painful or like uncomfortable. It feels slightly gaggy,
Interesting. Okay,
just to share
good.
my thoughts.
Yeah, yeah, yeah. And is that gaggy feeling a familiar feeling? Is that something you've had before?
I've had Globus before. I've
Ah,
had Globus before. And yeah, I mean, I don't tend to gag myself, but yeah, so not often. But I guess that's my reference for it. It
yeah,
feels slightly gaggy.
yeah, yeah, yeah. And
It's a
you are,
whole
you're
thing.
in the region of where gagginess takes place, so it's not surprising. Is it unpleasant enough to make you want to stop?
No, no, because I can feel the a stretch that's kind of taking over
Place.
that gagginess.
Yeah, good. Let's try it with the jaw released. So, and because I know this is kind of a stretchy thing, but if you just get very interested in your fingers
Mm.
and what they're doing, and maybe play around with slightly different positions, then we're definitely in the territory of manual therapy. And I do similar things to my clients. So, just be kind of interested in how sophisticated your fingers can be around the ends of the clavicle, the top of the sternum. I've got a funny sternohyoid that pops. I'm not sure it's coming through. I think it's coming through. So when I swallow, I can really see how that muscle tucks kind of under the SCM there. So I
Yeah.
can make a really clear connection with it. And then, yeah, do the same movement, but this time release your jaw. So look up
Okay.
now, but keep your jaw soft and just notice any difference. You'll
Yeah.
probably feel, well, you tell me, how did that feel?
I can feel that going up into the masseter muscle.
Uh-huh.
Yeah, stretching or like allowing us a sense of what I assume is unbiting or
Mm.
release in that area.
Mm. Yeah, good. And then my favorite, partly 'cause it's just fun. I mean, I would if I was teaching you, obviously, we would do these a little bit slower, a bit more, but just to begin, is to look up with the jaw open.
Mhm.
Usually the head will go a little bit further. That's functionally makes sense. So you'll normally find a point that's a bit further up, still within your 80%. And then hold that position. So you're going to be up there
Mhm.
and open and close your mouth. And you'll get this really kind of cool, fun sensation of the whole anterior neck, the whole of the larynx shifting up and down.
Okay, I'll turn to the side for
So,
this one so we can see that.
oh yeah, okay, thank you.
Okay, so
That'd be really
fingers
nice.
in the same place.
Yeah, and thoughtful
Yeah,
thinkers. So it's not just
yeah,
like it's like really
it's
being
think.
interested about what you can find.
Mhm.
And then with
Okay.
the jaw released, you sort of float your head up. And without going to it too far, just open and close the mouth and feel everything lift. It's so pretty. I love this. You can just sort of see everything shifting and lifting. And I think 3 times is enough. And just make sure you're breathing with that so you're not holding your breath. I don't think you are. And then float back down.
Yeah, I like that one.
Yeah, me too. And that felt safe. You didn't have any dizziness or ringing in your ears or.
No, nothing like that. No, but I can tell now when you're kind of reminding me, I don't have to go too far. It does kind of give give a good reminder of actually you don't have to go to that extreme. You can still have an effect, keeping that a little bit further from the end there.
Yeah, and if you do go to, I mean, stretching is a curious thing, and its value is sort of contested even within the world of sports and so forth. I'm sure you've come across those debates; they're quite current. But if you take a stretch into a kind of full degree, the antagonist is going to contract. So if we're looking to release things and get things moving, I think it makes much sense to go to extremes. Actually,
Mm.
I think just do a bit less. That's done something to open up that whole anterior throat region, the
Yeah.
perilaryngeal structures. I think again things that maybe I'll just do things that I wish I'd known when I was a voice teacher.
Yeah.
I really like attending to the submental region.
Mm.
So mentor is Latin for the jaw. I
Mm.
don't think we have a better name for this. I think calling it the tongue root is probably unhelpful, actually. I think it's probably something we should stop doing because that region, this region, is layered and there are many muscles there. Um,
And that's the one just
Essentially, the
immediately
digastric follows.
underneath the chin.
Yeah, above the hyoid bone and
Hmm.
beneath the chin. So this is a region where we're going to do sort of squeezy things here. And because we're going to be squeezy, if somebody, hyoid bones sometimes sit quite high. So if when you squeeze, you really feel like you're on your hyoid bone, just be lighter. I mean, we'll use light touch anyway. But yeah, the region kind of underneath the chin. As I say, we don't have a simple name in English for it. That region, it's the suprahyoid stuff, it's the submental, it's beneath the jaw, and yeah, it kind of has something to do with the tongue. But
Yeah.
it's digastric mylohyoid, geniohyoid, which is a breathing muscle. I mean, I mean, maybe you know that clearly. Maybe all your listeners do. I don't think I quite grasped that idea when I was a teacher. That there's a muscle in this region which is principally, perhaps, there to pull the hyoid bone forward on inspiration. So just palpate that region. So with your thumbs, perhaps, just have a little feel around. And don't make any judgments about how your tissue should or shouldn't be. And if your body knows a way of doing this, I always think these things are interesting. So if you have done this a million times before, you'll kind of do it in a way that's connected to how you were first taught it. So there'll be all sorts of values and ideas gathering around the way you touch yourself at that point. So that's one of the reasons why it's sometimes useful to have a different tool, different grip, a different way of touching, because then it won't quite have those connotations. So yeah, I guess we all did a lot of this when we were younguns. So maybe let's change the grip to a more of a hitcher's thumb. And rather than thinking, perfect. So yeah, for listeners, we've got a sort of in the old days we used to go hitchhiking structure. So thumbs sticking up, fingers together in a light fist. And we're going to use that tool to connect with that whole area under the chin. You can hear it's changed my voice slightly. And now rather than exactly massaging, just relax your shoulder and let your finger and thumb stick to anything you feel. There'll be skin, and then there'll be tissue somehow under that. And then just release the jaw slightly. Beautiful. Release the breath a little bit somehow, so it's just able to do what it wants to do. Let the shoulders sink. And just see if this whole region can let go a little bit, soften a little bit, maybe sink a little bit. All right, I like this because you can actually sort of feel the connection up. I can feel it all the way up to my cheekbones, certainly. That there's all sorts of tissues and connective tissue being dragged down. And then see if you maybe this is nice. Maybe you want to stay here. Maybe you want to stop. Maybe you want to add a little twist or a little drag to the. I think I want to go over here. Just sort of imagine you're a. There you go. Great. I feel great. Maybe imagine you're a sort of brilliant massage therapist, and you just sort of get a sense about where you'd like to go, or what would be ideal for you today in this region. But don't use your brain to figure it out. Don't use your kind of thinky. Just
Turn that off.
make it about touch. Yeah, 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 yeah. Because there's no answer. The answer your brain was looking for, it doesn't exist.
Okay,
It's
yeah.
just
So I
feeling.
wanted to go to grab and release.
Yeah, and that's fine. So that's okay. That's good. Let's do that. Yeah, feels good.
This is really weird that I'm doing it with my left hand because usually I'm so rightly dominated.
Do you have a thought why you're doing it with your left?
No idea. No idea.
Maybe to
Maybe,
break the habitual pattern, maybe because I gave you that thought of
yeah,
using a
maybe.
different tool.
I think also my left hand is it doesn't feel as strong as my right hand. So maybe it was the case of maybe I just wanted there as a lighter touch, maybe.
Mm,
Who
yeah.
knows?
Is that region relevant to you? Is that an area that you've worked on as a singer for your voice?
Yes. I do tend to feel a lot of kind of push down underneath my chin, under my tongue. Um, I don't think I've ever been told I have tongue root tension. Maybe that's somewhere planted there. But I do sometimes feel some a tonguey relationship in certain parts of my voice.
Hmm. Yeah. I mean, and it's going to be involved. I mean,
Yeah.
it's going to be there. Um, you can work on that region from the inside as well. We do lots of
Mm.
intraoral techniques, but maybe not on Zoom today. But there's nothing unsafe about having a little feel around in that region. It's quite an interesting place to go
Yeah.
with a thumb to feel the connection.
Yeah.
Um, so that's in a way we've looked at the whole structure. We've looked at the suprahyoid stuff. Um, my favorite way of working a little bit more specifically is to use a hand position a bit like yours. So I use this sort of butterfly hand kind of thing, and then I'll put my hands or get people to put their hands onto their larynx. So the thumbs are kind of either side. Yeah, so the thumb is actually the principal tool. Quite like this, feels safe, feels like my hands can relax on my shoulders. And then just mobilize the larynx left and right. So with your thumbs, just feel. And you asked a question earlier, which we didn't really deal with about pain. And if you put the same amount of noxious stimulation into 100 people, and then ask them to describe what they experience in terms of pain, you will get a really clear graph from people who will describe it as utterly agonizing to people who will say they can barely feel it. there is no objective experience of pain. So for some people, this amount of contact in this region would be extremely unpleasant, and for some people, it would be nothing at all. There's no way of knowing that apart from you knowing it. So does this feel okay for you?
Yeah. Yes, it
Good.
does. Yeah. I have a question about the larynx when we're kind of wobbling it from side to side.
Yeah,
So I don't know if this is the case or not, but I feel like my larynx moves quite a lot.
yeah.
And also there's I'm like a bag of crisps. It's a crunchy old thing in there. What is that? And is that quite normal? Is it a typical tendency?
The amount it moves varies hugely, and I think that's one of the places where any kind of hypermobility is really relevant. And if it's a very, very movie larynx, then I don't think it's a great idea to take it sort of as far as it can go. And it doesn't indicate sort of functional health. It's tempting to think it would, that a certain amount of mobility would be useful. I think a certain amount of mobility probably is useful. And also in terms of turning the head. I mean, what I often say to people, it's quite robust, this region. Because if you think about walking down the street or playing a game of football or whatever you do, it's moving all the time. Um, it's quite a fun kind of game to play with people. If you increase mobility and ease in the larynx or in the tongue, actually, there's often quite a radical improvement in range of motion movements of the head.
Mm.
So it was my first kind of slight kind of end of the pier trick when I was a voice teacher. I would always get people to do that, to take their head around in lateral rotation and then do a tongue exercise and then get them to repeat. And often the movements improve by 20 or 30 degrees.
Yeah, that's incredible.
It's kind of cool, isn't it? So you go, well,
Yeah.
it's functionally part of the neck and everything is connected. So maybe I would say maybe voice work will help your dancing, which I think is true. So who knows? Maybe you've got a very flexible larynx. Maybe you've done loads of work. Maybe you're a speech level singer. Maybe you're hypermobile. That's what I mean. I don't know, but I think it's quite nice to have a mobile larynx. But don't take it as far as it will go. Um, and the crunchiness is to do with this relationship with the spine, which again is really interesting. The larynx is very, 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 very close to the spine, which is in the middle of us, and the only thing between the larynx and the spine is the esophagus, but the esophagus is just a flat bit of tube when there's not food going down it. I mean, it has muscles, that's a simplification, but it's not a particularly bulky structure. So the crunchiness is the feeling of the larynx in its relationship with the spine. And because yours is very mobile, you could call it crepitus, you're going to get more crunching than others. So it sort of doesn't really mean anything at all.
Yeah. Well, I can immediately feel swallowing is different.
Isn't that interesting?
Yeah, swallowing feels like less effort.
Just from these three little movements.
Yeah. And again, it's one of those things of did it? Has it done that? Or I mean, I can physically feel a change. Um, and it just maybe is a good awareness for myself of this is actually when it's released and not going to the extremes of movement. It doesn't need to be that far over or coming at my ears.
And there are some very kind of advanced moves you can do where you come around the back and make some sort of connection with the arytenoid cartilages. So there are moves, and also if you take the larynx out a long way, you can come to the front and affect the muscles that run up the front of the spine, the longest muscles.
Yeah.
If you're just playing with it, I would just play with it. Just be kind to it, and see. It's funny when I put my hands on there, I felt a little bit of something, some kind of discomfort about here. So it makes intuitive and professional sense to me to give that some attention. So now if you change from just gently enjoying moving it around, mobilizing it, to sort of thinking, is there anywhere that I'm drawn to? Is there anything that feels interesting actually? And that interest could be pain, or it could be tightness, or it could be anything. Then give that a little rub. Just go into that and attend to it and be nice to it and say they're there. I think that's probably the crucial message to communicate, is just to say they're there. And sometimes when you do that, those things change.
Yeah. And I know that earlier you were saying about how this can become like a bit of a neuroses in our routine. So how
Mm.
often would you suggest for us to be doing this sort of self-massage?
Well, to be harsh, that's the neurotic question. I think I don't think that is best answered, because I think if I said you must do 3 self massages a day, and then people say, and you must come and see me once a week for the next 6 months to fix your larynx, which is rotated to the left. I don't personally believe any of that. I think that a person who's got somewhere with their work and with their life and with themselves will just know. They'll know when they need to do this thing, and they'll know when they need to do that thing. And
Yeah.
any sort of very formal approach actually messes with that.
Mm.
So I go weeks when I don't do any self massage, and then in the middle of the pandemic, when I was having various types of nervous breakdown, and often found myself in Premier Inns in various cities, kind of working with terrible jaw problems, I would do lots of self massage, and I think it really helped me. And I would find very specific areas that felt like they were related to very specific experiences. But when things are going well, then leave yourself alone. I mean, it's so there really isn't an answer to that, and that's not an evasion. I think actually that's an important answer.
Yeah, that's fair enough.
Say, what do you need?
So a lot of the time, so for example, many of us could start a lesson with a stretch and massage and a body scan, but actually, would it be more beneficial for us to say, do you feel like you would benefit from any area of self-massage at the beginning of this lesson or throughout the lesson? And if the answer is yes, we follow, or if the answer is no, we can just go along.
Yeah, I like to teach that way. I mean, that immediately puts an awful lot of agency on the person, doesn't it? And I could feel in
Mm.
myself almost a sort of panicky feeling as you said that. I think
Oh,
I was imagining being a young student, because but I think that's fine, because actually that's really saying to people, it's your career. I mean, how long is a career, and how many changes are we going to go through? Like how different do things end up to what I never expected to be working in Broadwick Street in Soho with elite singers. That's not anything I anticipated. So I think that's really cool. I also think if you see the panic in somebody's eye, if they're 19 years old and they haven't got a clue, you identify that as a skillful teacher and you offer them some structure and advice. But getting people to the place where they have real independence and sovereignty, I think is probably pedagogically important. I think it's politically crucial, and I actually believe that artistically, it's in those spaces where people's real work happens.
mm,
It's when people accept, but both the kind of the power and the responsibility for their own curiosities and gifts, that original work takes place. So I think as teachers, even in what may perhaps sometimes be quite a technical space, I think we should always be demanding that of our students.
mm. So, if you could round up with your top three tips for us moving forwards using self massage, what would they be?
Um, well, I'm not sure I want to do that in that, although I'm very happy both doing and teaching self massage. It's not the center of my work, although I'm very happy our conversation has gone that way. I mean, I think my top tip is watch a horror movie, or which I find difficult advice, but I force myself sometimes to actually do something that's not anything to do with my work or my family, but which is purely pleasurable. And I quite often say that to people who've come to Broadwick Street in a state of crisis. What's the thing that you do that really, really relaxes you, that's not to do with anything else? And for me, that's watching horror movies. I quite enjoy horror. It's a bit of a guilty secret. So if I find myself on a train somewhere, I will sort of go onto my Shudder subscription and watch some terrible horror movie, and I'm often astonished by how much better I feel afterwards.
Really? Okay, wow, okay. Mine would definitely be a chapter of a book. I'm much more
Oh,
reserved.
it's much more classy as well. I wish I'd said that. That sounds good. Yes, I enjoyed Anthony Trollope. That's exactly what I prefer.
Have you seen
Um,
The Haunting of Hill House?
I haven't watched that's TV. That's a series, isn't it? Netflix.
Yes.
Yeah, you see, I rarely have the time for a series, but would you recommend?
I would highly recommend. It's
Okay.
I find scary stuff funny because when it makes me jump, I just howl afterwards. I just find it extremely
Mm,
funny. But there are
mm,
moments in that where it's freaky, and actually does the scare very well. So yeah,
mm.
if you want to shit yourself, there we go. That's the one
Nice,
to
thank
go
you.
for.
That's good. I'll do it immediately after we finish our call. So anything that really brings one from a sort of a heightened state into a calmer one and distracts. I mean, distraction is very effective if you're dealing with pain of all sorts or crisis of all kinds. I think my next thought would be to think of the body as a whole. I mean, I sometimes wish I could communicate more clearly to people that I sort of would quite like to work on their feet before I work on their larynxes.
Mm.
And in my own kind of practice, I will always do big whole body Qigong influenced stuff, and it often does the trick. I don't think there's necessarily any point to head into the location. So watch a horror movie, do some Qigong, and then with great compassion and curiosity, rub the ouchy bit, the place that feels relevant, with a thought of there, it's going to be okay, and calm the whole region down. I think those would be my three tips.
Amazing. And you say that you teach this to other people, and we've had some of our
Yeah.
BAS graduates go on to your courses. So can you tell us a
Yeah.
little bit about those and when we might be able to get on to the next one and how much that might cost us?
Yeah, I don't have the exact figures to mind, but I can give you kind of ballpark. So we teach, we as in the Voice Care Center vocal massage training wing of the Voice Care Center, we teach modulars and intensive courses. We try to run the modulars every month. So that's 2 days a month for 6 months. So it's 12 days of teaching, 6 modules. And then the intensives are 9 days straight. So it is quite intensive, or quite intense. We try and do a couple of those a year. Stephen also teaches those in Devon. I usually teach in London. And I think they're brilliant courses, actually. I love teaching them. We get a really interesting mix of people. Sort of classically, we'll have a speech and language therapist and a singing teacher and an osteopath and a physiotherapist, things like that. They're often quite mixed groups. And in that period of time, we can communicate, I think, a fairly coherent, reasonably comprehensive, actually, set of movements and protocols and thoughts, and have time to work out the stuff that circles around that, the business of taking a case history and how to communicate to actors and singers. We keep the groups really small, so I never teach more than 4 or 5 tops in Broadwick Street. So it's a good training, actually. You really get to learn whatever it is that we can communicate, to teach. Cost wise, I think the modular is just under 400 quid for the 2 days. So that'd be 6 times 4. What's that? 2,400, something like that, I think,
Yeah.
for the course. And the intensive is priced similarly. Actually, it's just given in a different way.
Yeah. Great.
And that leads to a certificate and, as importantly, insurance in the UK. We probably should say that unless you have a specific qualification, you probably shouldn't put your hands on somebody else,
Mhm.
um, because you're liable if anything goes wrong or anything was seen to go wrong. So the insurance is quite important. I feel bad saying that because actually, as a teacher, I was constantly prodding people and poking people and quite happy to use my hands. I mean, that was also part of my training, was the sort of what sometimes called touch-based cueing. But I think I wouldn't be vigorously massaging somebody's hyoid bone,
No,
uh,
but we
unless
can
I had a
guide
qualification.
them in front of us
Yeah,
in like what you've described for us today.
yeah, totally,
Yeah.
and more. There are more things you can do. Yeah, absolutely.
Great. Well, Robert Price, it's been such a pleasure to be with you today. Can you let us know where we can follow you and your work and get in touch with any questions we might have, or even book a session with you?
Yeah, totally. Yeah, you can get me. I have a terrible website. I should probably
Oh,
get
me
somebody
too. Don't worry.
called Vocal Mass. So Vocal Massage London is my company, and you can email me at robert@vocalmassagelondon.com. I think that's right. I also work for the Voice Care Centre as part of the multidisciplinary team. So if you wanted to have an assessment, the Voice Care Centre website is easy to find. And I think I sent you the link for the vocal massage training, which is a part of the Voice Care Centre. But it's certainly if you Googled vocal massage training London, you'd get to us fairly swiftly, I think. And yeah, I'm always delighted to talk to people. That'd be really interesting. Also, Robert Price 1869, which is not the year of my birth, at gmail.com. Robert Price 1869 at gmail.com. If anybody has any thoughts, that'd be lovely. I'd love that.
Brilliant. Well, Robert, thank you so much for keeping me company.
It was a pleasure, Alexa. Thank you for having me.